Hello, and thank you for joining me for my research proposal presentation. Today, I will be talking about the effect of omega-3 supplementation on young women with chronic migraine. Migraines are not to be confused with a common headache, as migraines are a debilitating condition that impacts approximately 16% of adults in the United States. The majority of people who suffer from migraine headaches are women between the ages of 15 and 49 years. Migraines not only affect individuals' ability to complete tasks of daily living, but also negatively impacting their quality of life and is commonly associated with lower socioeconomic status. Furthermore, people that have 15 or more headaches a month, with at least 8 of which being meeting migraine criteria, have chronic migraines, which pose an even greater burden to normal living. Because of this great burden, there is constantly a need for new and different treatment options to help more people find relief from migraines. My research question for this project is that in women with chronic migraines aged 18 to 30 years, how does the daily supplementation of 1,800 milligrams of omega-3 polyunsaturated fatty acids twice daily compared to a placebo impact migraine frequency and intensity over a 6-month period? Migraine research includes studies of diet, lifestyle, pharmacological agents, and supplements like omega-3s and curcumin. Eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, are two key omega-3 polyunsaturated fatty acids that have been studied for their pain-reducing and anti-inflammatory roles in migraine treatment. Researchers have studied EPA and DHA at varying doses for migraine treatment, which has contributed to inconsistencies in the research. Several studies have evaluated the effects of manipulating dietary intake of omega-3 and omega-6 fatty acids to see if different ratios of each impact migraine. Several studies have shown that higher doses of omega-3 were effective in reducing migraine frequency and intensity. Current gaps in the literature include short study durations, studying both subjects with chronic and episodic migraines, EPA-DHA dose ratio differences, lacking placebo or adequate controls, and small sample sizes. The methods for this study would be that women will be recruited from 2 large neurology clinics in the Richmond metro area in order to recruit a final number of 160 participants after meeting all inclusion criteria. After confirming eligibility, participants will be provided with information about the potential benefits and risks of the study prior to signing an informed consent. The participants would be randomized with stratified random sampling in order to equally expose subjects from both clinics to the 2 treatment groups. Data from migraine frequency and intensity would be gathered by the use of Migraine-Specific Quality of Life Questionnaire, MSQ, Migraine Disability Assessment, MIDAS, and Migraine Buddy, a migraine tracking application. An eligible participant for this study would be a female between the ages of 18 and 30 and meet the criteria for the International Classification of headache disorders for chronic migraine. Exclusion criteria is much more extensive as to try to reduce confounding factors. Several are listed here, include the use of omega-3 or similar supplements, traumatic brain injury in the last 3 years, dietary restrictions or preferences, recent Botox, if currently pregnant or breastfeeding, as well as other criteria. For statistical analysis, an independent t-test would be used to evaluate the significance of difference in migraine frequency and intensity when compared to placebo. Additionally, the researcher would perform several paired sample t-tests to compare changes in frequency and intensity of migraines within groups from baseline to month 3 and month 6. Discussion. Several strengths of this study include the longer study duration of 6 months, the well-powered sample size, placebo-controlled, double-blind, and the nature of the sample may provide promising direction for the future research for young women with chronic migraine in particular. The limitations include issues with participant compliance, and that since the sample is only young women with chronic migraine, it does not provide a generalizable correlation for the migraine community as a whole. Regarding future research, this study could open doors to continued exploration of omega-3 supplementation for migraines, for example, with dose-dependent trials analyzing other migraine subpopulations like wider age ranges, men, and comparing chronic and episodic migraine. Additionally, it would be interesting to see how high omega-3 diet would compare to supplementation, and finally studying the efficacy of acute omega-3 use for migraine attacks. Here are my references. Thank you for listening.